Good morning, I'm Dr. Memeo. I'm a surgeon and I'm working here in the HPB unit at Hôpital Civil in Strasbourg. So we are going to speak about the surgical anatomy of the liver. As everyone knows, we can identify in the anatomy of the liver surface landmark and deep landmark. Each one of them can help us during the hepatectomy to obtain the correct resection and to have the correct margin to avoid to have a positive margin resection. So concerning the surface landmark, we can identify when we are performing an hepatectomy three kinds of surface landmark. The first one is the round ligament that is anatomically between the left lobe and the right lobe of the liver. We can identify the hepatic hilum who divides the left liver and the right liver, and we can identify to the gallbladder who is in junction with the middle hepatic vein and who divides the left and the right liver too. So these kind of landmark are called surface landmark because we don't need any instrument to identify them, and so it's easy to repair on the surface of the liver. Concerning the deep landmark, there are some landmarks who have an important role in the identification of the segment of the liver, and so they will be analyzed during the operative time with the Doppler ultrasound or with the 3D reconstruction that can be analyzed during the hepatectomy. First of all, we have the portal vein. The portal vein who is divided in left branches and right branches of the portal vein. The left branches guarantee the inflow to the liver to segment 2, 3, and 4. The right branch of the portal vein allow the inflow to segment 5, 6, 7, and 8. The right portal branches is divided in an anterior right portal branches and the posterior right portal branches. The anterior one is for segment 5 and 8, and the posterior one is for segment 6 and 7. After that, as can we see in this image, we have the hepatic artery. Hepatic artery that starts from the celiac trunk, and we can identify on this line the common hepatic artery who divides in proper hepatic artery and gastroduodenal artery. And in the pedicle, in the hilum of the liver, we can identify the left portal branches of the hepatic artery and the right portal branches of the hepatic artery. More of them, we can identify three hepatic veins: the left hepatic vein, the middle hepatic vein, and the right hepatic vein. The left and the middle hepatic vein comes from the same trunk, who is called common trunk of the vein, and the right hepatic vein is separated from them. We will see they are very important to divide the liver in different segments, and it will be useful during the hepatectomy to find the correct plane of dissection. Moreover, it is important to the presence of the bile duct. The bile duct with its anatomy that is very complicated and who has a lot of variation, and we will be very attentive to this variation, and we have to study it perioperatively and intraoperatively to avoid the lesion of the bile duct. So as we can see, all these elements allow to have some landmarks that could be useful and very important during the hepatectomy that will allow to identify the correct zone in the liver. Moreover, as we can see in this picture, we have a lesion, and we can identify with the ultrasound some important landmarks who can allow to have a correct resection of the zone with the tumor. In this slide, we can see that liver is divided in functional independent units that are called segment of the liver. One of the most important concepts in the anatomy of the liver is the control of the bleeding. Bleeding during hepatectomy that is responsible of major complication, and who is guaranteed by an inflow of the liver who is done from the portal vein and the hepatic artery, as we see in this picture, who goes to the left liver and to the right liver, and the outflow of the liver with the three hepatic veins. So as we see in this picture, we have the left portal vein in blue with branches for segment 2, for segment 3, and for segment 4. And we see in the left part of this picture the right branches of the portal vein with the anterior branches and the posterior branches. The same anatomy is followed by the artery, when we have the left hepatic artery, left branches, sorry, of the hepatic artery and the right branches of the hepatic artery, and is followed by the bile duct, who respect the same order. Speaking about the portal vein, we have most of time the anatomy that we have told before, with the left portal branches and the right portal branches, who is divided in anterior and posterior branches. This is present in about 89% of cases, and so it's very difficult to find some anatomical variation, and this is typically present in type 1 bifurcation of the portal vein. Other situations have aberrant right portal vein, who can come from the left branches of other situations that are extremely rare and who are typical of type 2 and type 3. Same problem for hepatic artery. Hepatic artery could have different situations. We identify 5 different situations. The typical one is the one with the hepatic artery who is spreading from the celiac trunk and who is going in the liver. In other cases, we have a left hepatic artery who come from the left gastric artery. Other cases too, we had a right hepatic artery who comes from the superior mesenteric artery. As in type 4, we can have all the hepatic artery coming from the celiac trunk and the left hepatic branches coming from the left gastric artery. Other cases too are present, and in rare case we have other anatomical variation. Bile duct 2 is follow the classical division in the hepatic hilum, and we can have classical situation with the left hepatic duct, right anterior hepatic duct, and right posterior hepatic duct in 57% of cases. All other variations are present. The most important one is the one that we usually find in about 20% of cases, in which the anterior right hepatic duct spread directly from the bile duct, and the left one gives the origin to the right posterior one. This is very important during major hepatectomy, and we can have injuries due to this variation if they are known before. There are some possibility to study in perioperatively the variation of bile duct anatomy, and this is with cholangiography. So as we see in this superposition of images, we have all the 3 elements, and then we can identify with this picture the anatomy of left portal branches and right portal branches, as we see, considering too the importance of the surface landmark that are the round ligament and the gallbladder, who give us the axis of the pedicle. Concerning the outflow, we have the hepatic vein, who are responsible of the outflow of the liver, and we have the right hepatic vein, middle hepatic vein, and left hepatic vein. As we said before, we have mid hepatic vein and left hepatic vein, who are together in the common hepatic trunk. It's possible to have other small vein that goes from the liver to the vena cava, and we can identify usually some accessory right hepatic vein or inferior hepatic vein, and some small vein that goes to the segment 1 that is close to the vena cava. They are called Spigelian 1. So the outflow, as we see in this picture, is very important and is divided by the hepatic vein. We see the right hepatic vein in this picture, the middle hepatic vein, and the left hepatic vein. Every segment of the liver is drained by one of these veins and is responsible to the definition of segment of the liver. As you see in this plastic model of the liver, we have about 8 segments of the liver. Each one has his own Glisonian pedicule and has for the inflow, in which we can find hepatic artery, portal branches, and the bile duct. And he has his own hepatic vein, who is necessary to the outflow of the liver. Each segment of the liver is after that branched to the vena cava by the hepatic vein. When we speak about the segmentation of the liver, we can identify 2 lobes, the right lobe and the left lobe. 8 segments. Segment 1, who is called the caudate lobe. Segment 2, 3, and 4, who are part of the left liver. Segment 5, 6, 7, 8, who are part of the right liver. We can divide the anatomy of one segment in 2 parts, and we will speak of subsegments, especially in the segment 4. We have a 4A and the 4B. which are the apical one and the basal one. So to code this differentiation of segment, we can identify the most important classification, that is the Brisbane classification, who has been done in 2000. And with this classification, we can identify 8 parts of the liver, and considering how many segments we are resecting, we can have different kinds of hepatectomy, starting from a segmentectomy to a bisegmentectomy, a 3-segmentectomy, up to measure hepatectomy or extended hepatectomy. So as we saw before, it's very important to have the perioperative way to study the anatomy of the liver, also to have the possibility to verify constantly during the hepatectomy the changes of planes and of axis of the vessel. In this picture, we see on the left side the 3 hepatic veins in ultrasound, on perioperative ultrasound. Here we have the right hepatic vein, which is horizontal in the plane of section. We have the middle hepatic vein and the left hepatic vein. And the same reason we can see the portal vein with the posterior branches and the anterior branches of the right portal vein. During the preoperative study of the case, meaning on the CT scan, we can identify some landmark who can allow to comprehend the different segments of the liver. So if we analyze this image of the CT scan, we can see the left portal branches who divide segment 2 and 3 and segment 4. The right anterior portal branches with responsible of the inflow for segment 5 and 8. The posterior portal branches who is responsible of the inflow of segment 6 and 7. The same reason and in the same way we can identify on CT scan the 3 veins, the left hepatic vein, the middle hepatic vein and the right hepatic vein. Each one of them allow us to identify some segment of the liver. So we can say that on the left part of the middle hepatic vein we have the left liver. On the right part of the middle hepatic vein we have the right liver. Between the left hepatic vein and the middle hepatic vein we have segment 4. Between the middle hepatic vein and the right hepatic vein we have segment 5 and 8. And on the right side of the right hepatic vein we have segment 6 and 7. So at the end we can say that knowledge of the liver anatomy is mandatory to reduce postoperative morbidity and mortality. And the identification of surface landmark as round ligament, hepatic ileum and gallbladder, and deep landmark as hepatic vein, portal vein, and hepatic artery and bile duct are very important during the hepatectomy. We can confirm that the liver is organized in 8 segments. Each one of them represents an independent functional unit. And we can say that the CT scan, the 3D reconstruction, and the perioperative ultrasound are indispensable tools to obtain a dynamic evaluation of the anatomy during hepatectomy. Thank you very much.